Hello, fellow viewers. Welcome to our channel once more. We'll be talking this morning, January, being 1st of January 2024. I will start by wishing you a prosperous New Year 2024. I'll be dwelling on the topic with respect to heart diseases. That's a major problem we have been experiencing now lately in the field, especially where we are carrying out sensitization campaign and some free examinations. We've observed that many persons, including juveniles today, are having coronary diseases, heart-related diseases. And most of these problems originate from certain factors, which I will reiterate on. Previously, I talked some time about this, but I will repeat it again that there are some things you do and some foods you consume that will always create problems within your system. Particularly, we are talking about the causes of coronary artery calcification, which means the things that will make your arteries, the vessels where blood is flowing, to have calcification, something that is forming like a cement-like structure, an extra layer along the inner layer of the vessels, the arteries. And when this happens, it reduces the circumference, the space in which blood is supposed to flow, thereby increasing the pressure of blood. And when that occurs, the heart now stresses in order to regulate the blood circulation in the body. What are these factors that will lead to coronary disease or heart related diseases? Stress is one of them. When you are stressed up, when you have things that you consume like seed oil, especially soy oil, corn oil, canola oil, those oils that are rich in omega 6 acids, they are not too healthy for you. 6 and 9 acids that are not too healthy for you. Now we will not leave out sugars, refined carbs, refined carbohydrates that are also potential causes. Alcohol, of course, is a potential cause of coronary disease as well since it contains sugar, especially beer, less alcoholic factors that can cause heart disease are we'll find whiskey and wine. But when it comes to beer, it's a potential cause. Now, we also advise that smoking habits should be discouraged because those who indulge in smoking are also exposing themselves to coronary diseases. We should take note that for calcification to take place within the arteries, first of all, we should have inflammation within these arteries. Inflammation, like something like an injury, like a wound that will occur within the arteries. And when this takes place, there's a repair that goes on there. That repair is made up of cholesterol and calcium. When those two combine to prevent a damage within the inner layer of the artery, it forms a plaque. And all of these can also occur within the inner layer of the heart. So we should take precautions, avoid those kind of bad foods, the sugars, the refined carbs, and those kind of oils. We recommend oils, other foods and habits, good healthy habits like non-smoking, less heavy alcohol consumption. Also recommend that you should take good table oil for especially for deep frying. The oil we recommend is extra virgin olive oil, extra virgin coconut oil. Any other thing you are buying from your local market, especially Cameroon markets, you should know is not too suitable for cooking. We recommend extra virgin olive or extra virgin coconut oil because they are super rich in what? Omega 3 acids. And these are oils that are healthy. They are well accumulated by your body, your system. They have less or no effect on your circulatory system as well as your health in general. So we should understand that. And we keep away from stress. Stress is something you cannot run away from entirely your entire life. But we should know that we should avoid stress as much as possible. Sometimes you see blind and hear deaf. That's a potential example of somebody who is stress free. When you learn to hear deaf and see blind, it will be a good factor. That's one small principle I learned as a kid. So, my dear friends, we also have some other way to reduce these chances of coronary diseases. I usually recommend to my folks to go in for vitamin K2 and D3 whenever going in for calcium supplements. Most doctors do make errors sometimes. They are negligent, not that they generally make errors. They recommend calcium with D3, and forget that vitamin K2 is vital to ensure that the calcium deposit within the circulatory system or the arteries can be extracted from there and deposited where they belong in the teeth and the bones to ensure that it doesn't remain in large quantity within the arteries. So K2 is another vitamin that's not so common within our society. But if you see all modern medication or drugs that are produced recently, especially supplements that are carrying containing calcium, most of it should be having a combination of D3 and K2. But you can as well obtain vitamin D3 through sunlight, and you can also obtain vitamin K2 through liver beef, or you can have it through egg. And when we are talking about liver beef, it should be from grass-fed beef, or when we are talking about egg, we should be talking about organic eggs, egg from chickens that are not kept or being fed with feed that is produced using inorganic techniques. We mean organic fed birds, birds that eat freely, or their feed come from cultivation using natural techniques. Thanks for viewing. I will urge you to share. You press the like button, share with your friends and relations so that they should benefit from this. And before I would leave you, I will advise that we should all learn to go in for the heart pulse oximeter. The heart pulse oximeter is a small device, though small in size, but it's very important because it gives you a reading of your level of pulse rate, the number of time your heart beats a minute. I've said that in one of my videos. Your normal heartbeat should be 72 beats a minute, which is average. But if it's low, it should not be less than 60 beats per minute. If it's high, it should not be above 80 beats per minute. Though it can still differ with respect to your body metabolism. For instance, a pregnant woman will have a slight elevation in her heartbeat, as well as those on medications, those who are under menstruation, those who are having some viral infection and things like malaria. So your doctor is in best position to determine the cause of your change in pulse. But it's vital for each family to have a blood pressure machine, a blood glucometer, a blood glucose sugar machine, as well as a heart pulse oximeter to know your oxygen saturation level, how effective your lungs is carrying out its function, and how good your heart is carrying out its function. Thanks for watching my video. Don't forget to press the share button. Bye bye.